Hi, I'm Mark Mays. I'm running for Congress in Eastern Washington. And I'd encourage you to find out a bit more about me, what my positions are on the issues. And you can easily do that online on the internet at my website, votemarkmays.com. That's votemarkmays, MARKMAYS.com. I've been asked to talk a little bit about healthcare. I think we all know that there's some problems with healthcare. It costs a lot, and we don't have enough money sometimes to get the healthcare that we need. In fact, 1 out of 7 Americans doesn't have access to healthcare. Can't afford the insurance, can't get the insurance. Those who have insurance are having to pay more and more for it because it's very difficult for employers to carry the cost of that and stay in business. It's difficult to have access to healthcare. And I know a bit about that because I'm a psychologist, and I've been practicing in medical buildings for the last 30 years. And I've been on the staff of the major hospitals in Spokane, Sacred Heart and Deaconess, for decades. I've consulted for the Kellogg Rural Health Foundation. I understand a little bit about the problems of rural health delivery, very important in Eastern Washington. And I've been a consultant for a number of different agencies and institutions over the years. And I serve on the faculty of the University of Washington Medical School. And I think what all of that has told me is how difficult the problem really is. There are no easy answers to this, but there are answers. And I think the answers have to do with not just fixing a broken system, but kind of redoing a system so that it works better and more fairly. We view healthcare as a commodity. It's a product. You can buy it if you have money. If you don't have money, you don't buy it. And we're about the only industrialized country that views it that way. Most countries view it differently. Most countries view it like education. People need to go to school. We all need to have people go to school, so we all need to pay for education. But we don't view healthcare that way. We view healthcare as differently. And how does this make sense? If you had a family that had 7 children, you wouldn't say to the children, well, 6 of you get to have everything you want. 1 of you, you're just going to have to starve. Yet we do that with healthcare. The things that keep people alive, the things that make life worth living, are our health. And we have to change how we approach that. We have to not just view it as a for-profit situation in which the more you do, the more you get. We have to view it as a system in which the various team members work together to create productive outcomes. We're not paid for outcomes, we're paid for the amount that we do. There's a difference between being busy and getting the job done. Now, it's not the fault of the providers. The doctors, the nurses, the specialty people, the respiratory therapists, physical therapists, all the people who are part of this system work hard and are doing what they're asked to do and they're supposed to do, and they're doing it well. Yeah, we're not getting the outcomes that we want. But we're nowhere near the top in terms of effectiveness of the healthcare system. We need to look at a very different way to deliver care in which we're all kind of contributing appropriately and proportionately. And we're looking at the government not providing service. Nobody wants a government to provide our health care directly. But we need to look at a system in which we're having quality standards that are maintained and understandable to people, that's outcome focused, and that's accessible to people. The standards of quality are cost, access, and quality. Those 3 things they're different points on a triangle. And lately we've had to choose 2 out of those 3. We haven't had all 3. You can have quality and access, but you're going to pay for it. Or you can have cheap cost and access, but the quality goes down. We need to look at a way to balance those things more effectively. And the way to do that is to deal with letting people have access to basic care. And if they want to do something more than that, well, then they can buy that. But we have to have access to basic health care so that people aren't going to emergency rooms, so that people aren't letting conditions become more costly and more dangerous to their health as time goes on, so that they're not losing productive time at work because they're sick, because they don't have access to health care. It's good for the employers to have that burden removed from their shoulders. It's good for citizens to have access and know that safety really exists. And we can do this with less cost, greater satisfaction on the part of the people who receive care, greater comfort on the part of the health care providers if we view it differently. This isn't something that's going to happen quickly. This is a boat that needs to move slowly so that we don't knock people off by too rapid a shift. But it's something that can change, and it can only change if you understand the system and you have a goal and a star you're steering towards. If you have that, if you know where you're going, you can get there. But if you don't know where you're going, you're just going to end up someplace else. And if someplace else we've ended up with a representation we recently had, is a very broken system, a healthcare system that itself is in the intensive care unit. We can do better, and we must, and we can. And I'd encourage you to look at my positions. I'd ask you to vote for me, because I'll do all that I can do to bring my knowledge as a healthcare provider and as a consultant in healthcare to get the system working for us all a lot better than it is at present. If you want to go on Medicare in Spokane, and you just moved here, and you don't have a doctor, the system is so broken that you can't find one. That's wrong. That has to change. And I'll do everything that I can do to get it to change in the right direction, not just for the short run, but for a system that works for a longer time for us all. Thank you very much for your time.